And in my part, I couldn't help it. I just couldn't get out of bed. I couldn't, cognitively, you can't read, you can't watch TV, you can't speak. You're in pain. And that time it was frightening, and it's a sense of loneliness and isolation. And it was frightening because it wasn't diagnosed properly. And it wasn't until 1989 that I met a doctor, Dr. Jane, who was treating. And I walked into a waiting room like we have downstairs, and there were several other people talking about the same symptoms that I had. So that's
Do you think it's important that people meet?
Definitely. Definitely you need a support group, either by telephone, which we've done, or have a physician that understands and can help you. Because family members cannot, they just don't want to hear your problems all the time. You need an objective person to help you out. It's very evident in this illness that we look very well, and but we're very, very ill inside. What you see today, maybe I'll be in bed for the next 2 weeks, or maybe I had been in bed for the next 2 weeks. Now, one of the coping methods I use for this disease is when I'm well enough to get out, I dress up and feel good about myself. And but most of the time it's just, you know, wandering around the bedroom, eating in bed, that sort of thing. It's a very severe illness.
How would you try and spread the word? You know, a lot of people don't understand this disease. So how would you spread the word? If you could spread the word, what are some of your ideas on how to spread it?
Well, we need to have education for physicians, our general and our healthcare workers, and the public. How would I do it? By documentaries like this, by publishing pamphlets. It's an invisible disease. Invisible ailment, disability. People don't see it, so it's hard to understand for people. And it's also hard to understand for people. It fluctuates.